Hi, my name is Kamara, and I'm an obstetrician, gynecologist, and fertility specialist working out at Joondalup Private Hospital. And I spend my fertility time working with a group of consultants at Fertility North. I want to talk to you today about contraceptive options in women who have been diagnosed with endometriosis or who are suspected of having endometriosis. Now, as you know, endometriosis is a very debilitating disorder, and it affects up to 10% of women, and close to 40% of women who present for fertility treatment have known endometriosis. So the common scenario is a woman who's, in her 20s, who's not quite ready to have babies just yet, has been diagnosed with endometriosis, has had this endometriosis treated, and wants to plan her family life later on. What sorts of contraceptive options can we give such a woman so that we reduce the chance of her disease returning and her needing repeat surgery? Now, most of the international guidelines still recommend that the combined oral contraceptive pill or the progesterone-only pill remain the first-line management for women who have had confirmed endometriosis or suspected endometriosis. There are really good studies, including detailed randomized controlled trials and Cochrane reviews, that show very clearly that women who are put on the pill or who are put on the progesterone-only pill have a reduction in menstrual pain, non-menstrual pain, dyspareunia, as well as dyschezia. So definitely consider the combined contraceptive pill, or if you have a contraindication to the combined pill, you can consider the progesterone-only pill, and this remains to be effective. If you're the kind of person that's not very keen on taking tablets every day, then you can go on to consider the long-acting reversible contraceptives. And in this space, I would recommend you consider either the Mirena IUD, or you can consider the Depo-Provera injection. The Mirena IUD and the Depo-Provera have been shown to be not inferior to the combined contraceptive pill or the progesterone-only pill in managing endometriosis pain and other symptoms, as well as being very effective contraceptives. So they are definitely worth considering. In fact, if you look at the PREM trial, you will clearly see that patients who were put on the Mirena were less likely to have recurrence of disease. They were therefore less likely at about 10 years of use to need further operations or to step up to second-tier treatments such as GnRH agonists or antagonists, etc. So definitely all the simple contraceptives that have always been available to us still remain to be effective methods for managing endometriosis-related symptoms while you try to space out or plan your family in the setting of a diagnosis of endometriosis.